This is a little video that I've clipped together showing a very brief part of an osteopathic assessment and treatment of a patient of mine. His name's Andrew and he's very happy to be filmed for this reason. And I've been treating him for his upper back issues, neck pain and headaches. So you'll see me kind of setting up here and walking through parts of his neck assessment. I've already done a standing assessment by this time and I know quite a bit about Andrew's case, so this is the manual side of it where I'll work my hands up the back of his neck and palpate or feel each one of the joints and the associated muscles. He's had a long history with headaches, he's got some migraines, so I know where to look for sensitivity, tension and pain, and you can map that against the clinical history, and that's what I'm kind of doing there as I roll his head left and right. That's all still assessing the joints and mapping it against what the range of motion is when Andrew moves around and what his clinical symptoms might have been the last few days, just before he's coming to see me. And now you'll see me go into some of the actual treatment for it. So once I've identified the sore or the stiff joints in there, you'll see me kind of hold the head in position, pressure the muscles or inhibit them with my fingers, and then stretch and move his neck over the top of them like that. And also I'll start getting him to push against me with his head, and I'll resist that force, and then I'll get him to relax his muscles and I'll stretch it further after each time he contracts. And that's what's known as a contract relax technique or a muscle energy technique. That's quite common with osteopathic treatment. Quite gentle and it feels really nice. It's very effective when you can target it at the right joints or the stiffness that's associated with your symptoms. So we're still going on from that. You'll see my thumbs right down low on the base of his neck, some group of muscle called the scalenes, which are associated with the ribs and the side-to-side neck stability and movement. They often get quite tight with thoracic neck postural issues. After that, you'll see me go into something that's a bit more a stronger kind of neck mobilizing, or it's for the joints. And again, with Andrew's history of headaches, you'll see me mobilize some of the top joints in the neck. It's quite common with some types of headaches to get stiffness and pain from those joints referring up into the head. You can get a cervicogenic headache or a neck-generated headache, and also trigger migraines from irritation to those joints. So we're working on that with Andrew. My man Andrew loves the camera. Now you'll see me roll through his upper back, his thoracic spine, and use a different technique where I'll cup my hand underneath his back and isolate the stiffer sections and mobilize them quite strongly. So I'll use the heel of my hand. It's pretty comfortable to have done, especially if you use your body weight and you gently roll through that. It can feel quite good if you can target the right areas. And so you'll see me there kind of rolling him forward and back over that and trying to target where that, and I've also got some feedback from him as we're talking through that. Where's that stiff? Where does it feel sore? And working against that. Now you'll see me kind of roll through and use palm of my hand and put a bit more pressure on. I'm using his head to help stretch down to those joints in his upper back. And that's a manipulation treatment where I'll look to kind of pop or crack some of the joints that might be stiff and contributing to his symptoms. Just like that. Anyway, I hope the video's been helpful, and if you need more information, you can always contact the clinic. Thanks.